You are welcome, Dr. Ben Oko.
Thank you, Dr. Ino. Good evening, everyone, and a happy new month. I trust our day has been going on great so far. So I've shared my screen already. If you can't see it, please let me know. Is my screen visible?
We can see it.
Oh, that's great. So as the broadcast message said, today's topic will be how to prevent and manage peptic ulcer. I'm quite sure that this is not the first time we are hearing about peptic ulcer. It's quite a common medical condition in Nigeria, to be specific. And so hopefully by the end of this presentation, we would be able to know some of the common symptoms of peptic ulcer, what can cause peptic ulcer, and the little things that we can do to prevent or manage peptic ulcer. And so as a way of introduction, what exactly is this peptic ulcer that we all hear? And so peptic ulcer refers to ulcers affecting both the stomach and the duodenum. And so I know that this is like a medical jargon, but I'll try my best to simplify it as I can. And so we all know the stomach. So usually when we eat, food goes through the food pipe in the throat, which is the esophagus, and then it goes to the stomach. And so the stomach is quite easy to explain. And so what is the duodenum? So we all know the intestine, that very long and curly thing in our belly. And so the duodenum is a part of that long and curly substance. And so what has been shown is that peptic ulcer affects both the stomach and this duodenum. And when people talk about ulcer, to different people, it might actually mean different things. For some people, it might mean that injury. And so you would see people that have skin ulcer, foot ulcers. It's just a sore that has just refused to heal. Right? For some other people, when they talk about ulcer, it may mean that disturbing pain in the upper belly. And so peptic ulcer in particular is limited to the stomach and the gut, which the duodenum is a part of. And so that is what we'll be talking about today in this presentation: how to identify this peptic ulcer, what can cause it, and how to manage it. And so, like I've earlier explained, that peptic ulcer occurs in the lining of the stomach and is usually caused when there is a damage by the acid produced in the stomach. So one of the functions of the stomach, one of the ways that the stomach digests food is by producing acid. And so the stomach also has a lining, and so the lining secretes some substances that helps to reduce the damage that can be caused by the acid the stomach produces. So there's like a check and balance. And so once there's a disruption in this check and balance, the tissue, that's the stomach tissue, is then exposed, and this can then result in an ulcer formation. And so, I mean, we might wonder how common is ulcer. If there's anyone here that knows someone that has ulcer, has heard about someone that has ulcer, let me just type in yes in the comment section, so I know that this is actually a very relevant topic to us today. So if you know someone that has peptic ulcer, and it's easy for some people, it's actually it can be a long-term condition. And so it's just for you to, okay, so I can see some comments already, so that means I'm quite right. This is quite a common condition. And so the one very interesting thing about ulcers, remember I said it can affect the stomach and it can also affect the duodenum, which is a part of the gut. Globally, the incidence of these ulcers actually reducing, but there's one very important factor, which is complicated ulcers. So that is ulcers that have become complicated. It is still remaining the same. And one of the reasons why the incidence of complicated ulcer is still stable is because of some other lifestyle practices that we've been engaging in. And I'll talk about, so this NSAID, I'll talk about them later on. And then the aging population. So as we all know, every day that we wake up, we all get older, and with increasing age, there are some common medical conditions that has been found, and the very popular arthritis. I'm sure we've all heard of arthritis, and so there are different types of arthritis, and that is in layman language. Some of the symptoms can just include knee pain, just joint pain in generally, and some of what we use to manage this very popular medical condition among the as we get older is also has also been implicated in the cause and complication and what makes ulcers get complicated. And so that is why we're talking about peptic ulcer today. And so I'll be talking about what exactly has been shown to cause peptic ulcer. And so one very important cause is an infection. And the name of the bacteria that causes this infection is called Helicobacter pylori. And so for short, we'll just call it H. pylori. And so it is we all know bacteria, so I'll just refer to it as a bug. And so it's a bug that infects the lining of the stomach and the duodenum. And remember I said that ulcers is prevalent in the stomach and the duodenum. And so this bug has been found to affect the stomach and the duodenum. And it's actually a very, very popular infection. I mean, it has been estimated that half of the world's population has this infection. But the good news is that for most people, this infection is actually harmless. And so an individual may actually have H. pylori infection and then they do not develop ulcers. But most of the people who eventually develop ulcers, they actually have this H. pylori infection. And so this H. pylori is also very common in developing countries. As we all know, Nigeria is a developing country. And so one of the ways that this H. pylori bacteria is passed is from person to person. And so it's not from like animal to person, it's usually through human beings. And it can be from direct contact with saliva, vomit, or feces. And so this H. pylori infection can also be spread through, so once you take food or water that has been contaminated with the bacteria already, can also get this H. pylori infection. Remember I said almost over half of the world population has this infection. For most people, it's usually harmless. But for people that actually have this ulcer, a majority of them have this infection. And so how does this infection cause ulcer? Remember I mentioned that the stomach produces some mucus, which helps to defend itself against the acid that digests food. And so this H. pylori destroys the coating, which is the protective membrane. So just think about it like a clothing. And so there's a coating covering the stomach. This H. pylori infection then destroys that coating, and then it allows the stomach to be more susceptible to injury. And so basically that's one way it functions. I remember, like I said, in duodenal ulcers, 95% of people who have duodenal ulcers actually have this infection. And for that's for the stomach. People who have been found to have stomach ulcers, about 80% of them has also been associated with this H. pylori infection. And if you were in our previous discussion where we talked about bad breath, I'm sure that this H. pylori infection is not you're not just hearing it for the first time. It has also been shown to also cause bad breath. And so this infection can cause bad breath, it can cause ulcers. And so before I go into the second common cause of peptic ulcer, so some of the what we do that aggravate and increase the risk of getting ulcers, I would like to just ask a brief questions. And so if you can just list some of the common medications that we take for pain before I go into our next cause of peptic ulcer. So any common medication that you know that can be used to relieve pain. Let me just see you type it in the comment section. So Panadol. So Panadol contains paracetamol. Okay, I can see another person saying Panadol. Do we know any other strong painkillers? Okay, so let me classify strong painkillers. Diclofenac, yes, that's correct. Diclofenac. Any other, does anyone know any other example? Ibuprofen, that's correct. It's a strong painkiller, ibuprofen. Naproxen, yes, that's correct. Naproxen. All right, so let me just thank you very much, everyone. And so let me go to the second, what has been known to cause this peptic ulcer. It's called morphine. Oh, thank you. So morphine is higher than all these other things that we've mentioned. And so the ones I'm going to be talking specifically, they are grouped under the non-steroidal anti-inflammatory drugs. And some examples of these non-steroidal inflammatory drugs include ibuprofen, aspirin, diclofenac, naproxen. So those are some of the examples we've listed. And what has been shown is that chronic use, meaning taking high doses of this medication for a very long time, it disrupts the lining of the stomach. I remember I talked about the mucus coating of the stomach, and then once the protective membrane of the stomach is destroyed, it makes it more vulnerable to injury. And what has been shown that as many as 30% of adults taking these NSAIDs eventually develop some of these adverse effects that affect the GIT, that's the stomach and the intestine. And as such, it's very important that we pay note to this. And one of the other factors that has also been associated with an increased risk of peptic ulcer is older age. Remember, as I said, as we get older, there are some medical conditions that are peculiar to us to old age, like arthritis, and then the female gender, and then the high dose or combination of NSAIDs. And so for some people, they don't just take just one. So they might not just be taking ibuprofen, they might also be taking ibuprofen plus naproxen plus diclofenac. And it's usually very more common in people that just go to chemist shop. And so those places where they just combine medication and then give, because the likelihood of a licensed pharmacy doing this is actually really very low. And so it's usually very common in people who just, all those boys that just open shops and you just go there and just you want to buy painkillers, and they will just give you 3 things that are doing the same function, and you would not know because you didn't consult a qualified medical practitioner. And so moving on into the third causes of peptic ulcer, harmful lifestyle practice. And if you've noticed, in most of my presentation, I would always talk about harmful lifestyle practices, in particular smoking cigarettes. And so smoking cigarettes, it increases one's risk of developing these ulcers because it makes treatment less effective. And so it's not like a direct relationship. It's just that once an individual has peptic ulcer and the person is also a smoker, you notice that the treatment is not as effective as non-smokers. While for alcohol users, it can make their symptoms worse. And so this too is not like a parallel cause. It's just one of the things that can make treatment less effective and make their symptoms worse. And so I can see someone a comment about cocaine in the question. And so one thing that has also been found is that people who use cocaine, it causes the blood vessels to constrict. And so what do I mean by this? The blood vessels are like pipes that take blood throughout the body. And so this pipe becomes narrowed. And if it becomes narrowed, that means blood will not be able to flow freely. And if blood is not flowing freely in the stomach and the intestine, it can lead to the damage of the lining. And this can also increase the risk of the individual developing peptic ulcers. And so remember that I talked about peptic ulcers being a group. And so in some very severe physiological stress, and what do I mean by this? So an individual that has had burns injury, and burns, it destroys the skin. Any trauma that affects the brain, people who have had multiple traumatic injuries. This just means that, for instance, say an accident, and in this particular accident, the leg is affected, the hand is affected. There are just injuries surrounding all this. And sometimes some surgery, the stress, not the surgery itself, the stress of undergoing the surgery. And so another example is an individual who is seriously ill. And an example of this serious illness is something we call sepsis. And in layman's term, it just means an overwhelming infection. And how does this happen is that all these different things I've mentioned, it reduces the gastric pH. And so the gastric just means stomach. pH, for some of us who were in science classes, so pH is, remember I said acid, and so if the acid just means that the pH is low, and so it now makes this pH to become further low again, and then that means the acid production is increased. So it causes the high stomach acid production and increases the risk of ulceration. So people who are undergoing very severe physiological stress, like they've had burns, they've had accidents, stress of surgery, it can also increase the stomach acid production. And so for all these things, usually when they're on admission, medications would usually be given to reduce the effects, because this is physiological, means it's just something that happens. And so there'll be medications that will be given to prevent such from happening. And so the other thing I'll talk about is genetics. And so what has been shown, about 20% of individuals who have ulcer also have a family history of ulcer. So either their parents, their mom, their dad, sibling, and so on. And this other one, I just kept it for information's sake. And so you know how we have different blood groups. There's blood group A, blood group B, blood group AB, blood group O. And so there have been a weak association that has been formed between people having blood group O and duodenal ulcers. And so if you are just joining, I would just do a recap of what we've talked about. We've talked about what peptic ulcer is, meaning there's a disruption in the lining of the stomach and a part of the gut known as the duodenum. And there are so many things that can cause this. And one of them is the H. pylori infection. And H. pylori is a bacteria, and it is present over 50% of the world population has it. It's usually harmless for most people, but however, it's a majority of people who have ulcers have this infection, and it can be transmitted from person to person through contaminated food, saliva, feces, and the likes. We also talked about chronic and long-term use of strong painkillers like ibuprofen, diclofenac, combination that's using in combination or in high doses. It can also affect the lining of the stomach. We also talked about harmful lifestyle practices like smoking, alcohol intake. We talked about genetics. And so I will just continue in the presentation talking about what are the symptoms of ulcers. And so the very, very common symptom is abdominal pain. And this abdominal pain is usually in the upper belly. So that's the medical term just beside it. So the pain usually in the upper belly, and it might feel like a peppery sensation for some people. And remember I said that it can also affect the intestine, so they can be in the front or in the back. And if this ulcer is in the back, you'll notice that some people also complain that this pain in their upper belly is also they also feel the pain at the back. And so that's also a very common symptom. Another symptom can just be a feeling of vomiting, that's nausea. It can also be belching. The individual might feel bloated. Might just feel that the person is just very uncomfortable. The abdomen is distended. I remember, like I said, that it can also come like a pepperish sensation. And so the individual might feel some heartburn. And so these alarm symptoms, and so these are symptoms that once an individual has any of these, they really need to go to the hospital immediately. And that's because, remember I said that even globally, the incidence is reducing, but complicated cases have remained the same because of some of our lifestyle practices. And some of these some of examples of complicated cases includes bleeding. And so these ulcers can bleed, meaning the individual might be vomiting blood, or the stool might be stained with blood. And so if the person is losing blood, that means the person's blood level will become low, and that's anemia. And so this is like an alarm symptom. If you have any of this, if you know anyone having, and so some of the symptoms of this anemia can just be dizziness, or you feel your heart beating faster than normal. And so the person will need to, go to the hospital as soon as possible. Another one could be the person is eating very little and is getting satisfied. And remember that these peptic ulcers if in complicated cases, once it goes on for a very long time, these ulcers can actually transform and then become cancer. And then once it becomes cancers, some of the symptoms you might find maybe the individual may be losing weight, the individual may have difficulty in swallowing or even pain or swallowing. And for people who already have like someone in their family that have like stomach cancers, they would, if they have any of these alarm symptoms, they want to take it very, very seriously. Another thing that can happen to this ulcer is that they can perforate. And once they perforate, some of the symptoms you'll find that the person will be having high temperature, meaning the body will be hot. Instead of just one part of the abdomen paining the person, the upper belly, you notice that every part of that belly is paining the person. You cannot even touch the individual. And so before it gets to this very complicated stage, I'll also be talking about what we can do, to prevent it from progressing. And so some of the common tests that we just do to check for a peptic ulcer is the H. pylori test. H. pylori. So remember I said that majority of people have this infection, and so this H. pylori test can be seen from your blood or from your stool sample. And so these other ones are usually done for, because most people actually get better once they take the medication, but for some people they just do not get better. And for people who the ulcers become complicated, they might need to do a special camera test. And so a special camera test through the mouth to the stomach, where you can then visualize if there's any, if you can see any ulcer, if these ulcers are now bleeding, or if they've even perforated. And if there's any suspicious, if the doctor performing this procedure sees anything that is suspicious. Remember I said that for people who have long-standing ulcers, can actually transform to become cancer. A sample can then be taken of those suspicious lesions and can then be looked at under the microscope. So this other one is for this abdominal x-ray. So x-ray is like imaging of the abdomen, usually done also for complicated cases. Remember I said that it can also perforate, and then the individual would have pain all over the abdomen. And so now that we've learned about, the different causes of peptic ulcer, we've also learned about the symptoms of peptic ulcer. So how do we then manage and then prevent peptic ulcer? So if you look at the charts, some of these medications have been listed. And so of course, for long-term pain, you would not say that, okay, because you don't want to prevent this, then the person will continue living in pain forever. And so for some people who are just abusing these NSAIDs, they need to be stopped, and then it should be taken only if prescribed by a medical professional. And there are also other options to this NSAID, like someone also mentioned Panadol. And so the severity of the pain might actually not be that bad. And so Panadol just contains paracetamol. It not usually cause peptic ulcers, but again, everything still has to be taken in moderation. And so that's why I said if they can't be stopped, they should be stopped or replaced. And the good news about it is that there are also medications. And so there are some medications that are a combination of two. So it has this NSAID. It also has another medication that it reduces the adverse effect, and so it can have diclofenac plus something else. So it can be misoprostol. That's the common. It can also have either misoprostol or omeprazole in addition to this NSAID. And so it's always very good to, if you have any symptom, you speak with a qualified medical professional so that they look at your age and your whole history together, and they can then prescribe a safe medication for you. And so that's one. So there are medications that have additional protective medication. So there are combination drugs that have two medication, and one of them is actually protective. And so one other thing that we can do is to take this medication after meals. You don't want to take them on an empty stomach, because like I said, the acid production is increased. And so because the stomach is producing acid, taking this medication, that the side effect is also, it also increases the stomach acid production. It's just like a recipe for disaster. So you want to take this medication after meals. And so one other preventive strategy, like I said, remember I mentioned lifestyle. So smoking increases the risk of peptic ulcer because it delays healing. And not only does it even delay healing, some of the medication that can be used to treat peptic ulcer, smoking also opposes the action. So you want to have, if individual smokes or takes recreational drugs like cocaine, like I mentioned how cocaine causes ulcer because it narrows down the blood vessel, and if blood doesn't get to the stomach, the protective membrane is also destroyed. And so the individual wants to avoid smoking or recreational drug use. And the good news about this H. pylori infection, like I said, is that there are medications that can be used to eradicate it. And so just depending on an individual peculiar need, the eradication can actually clear this infection in about 9 to 10 cases if it is taken correctly for the full course. And so this is also a very important, it has to be taken correctly for the full course. And the full course can last about 10 to 14 days. And so most of the times you see people just take it for a very short amount of time and then they can have recurrence. So it's always good to adhere to any length of duration that you are advised to take medications for. And so there are some over-the-counter medication, meaning some medications you can get from the pharmacies. They're usually known as antacid. And so they neutralize the stomach acid quickly, and then they relieve the symptom in a short term. And so you can take this when you experience the symptom or when you expect the symptom. And so because an individual has ulcer, there's no special diet that you should say, okay, you must be taking this all the time. However, individuals are different. If you notice any food or any beverage triggers, maybe like caffeine or caffeine for some people, it can trigger or aggravate their symptoms. You'd want to, abstain from that. And one important diet, yogurt. So yogurt has been found to contain certain probiotics. And so what do I mean by probiotics? Probiotics just means good bacteria. And so yogurt contains some good bacteria, and this good bacteria can help fight. So if an individual has H. pylori infection, so it can help fight the H. So it's like it's competing with the H. pylori infection. And so that is why for some people, when they take yogurt, they have relief of their symptoms. And so this yogurt can also be a first aid, can serve as a first aid. And so contrary to popular opinion that milk actually is really helpful. So what has been shown is that milk can relieve ulcer pain temporarily because it coats the stomach lining. But milk also causes the stomach to produce more acid and more digestive juice, which can also worsen ulcer pain. So it's also good to note this. And so finally, obesity. And so I think sometime last year, we talked about, another doctor talked about the body mass index. And so usually you classify obesity as a body mass index greater than 30. So it just means the ratio of your weight to your height. It has also been shown to have an association with peptic ulcer disease. So it's always very important to maintain an healthy weight. And so I think that is okay. So in summary, remember I said that treating H. pylori does not mean it cannot happen again. It can actually reoccur. And so eradicating H. pylori reduces the recurrence rate from about 60 to 90% to about 10 to 20%. So it's important that the underlying cause is addressed for an individual to have a good prognosis. So I think this is the end. Thank you for listening. Let me stop.